The charity was originally started by parents of a patient, and very little was known about hereditary angioedema 40 years ago, I would say, when parents started to realise that there were other children or people that had these conditions.
HAE is called Hereditary Angioedema, and it's like a mutation of your genes. You can get it hereditary from family. I haven't. It's my genes mutated. So it's where your body doesn't react well to stress and trauma and lots of different things, and it makes your body swell up in really random ways, and it's horrible and it's hard to live with. There's a long path ahead to try and educate people on this.
It took 4 years to get diagnosed, but luckily a doctor found it.
Charlie had his first symptom when he was 3. We've just done a long haul flight and Charlie was sick for about 2-3 days. Then he went with no symptoms for about 6 months until Christmas Day. He woke up very sick with a big hand. Obviously he ended up in A&E because he was very, very, vomiting. This went on for a couple of years, going to the doctors. They tested all his joints because he couldn't come down the stairs. We even brought like a little trolley so we could take him to school in the trolley because he couldn't walk. So the hospital thought he had juvenile arthritis and sent us to Birmingham Hospital. And that's where we found that he has got HAE. Dad and I have both been tested. Both of us haven't got HAE. And then from there, we had a little bit more help and support from Oxford, got passed over to.
I was 18 when I had my first swell, and it was the combined pill that set it off. Within a month of going on the combined pill, I had my first abdominal swell, although we didn't know at the time what it was. They thought it was appendicitis. I ended up in hospital. In the middle of the night, they told me that I was going to have an operation. I was still there in the morning, and they said, no, we don't think it's appendicitis anymore. We'll just treat you for the pain. So when the consultant came around the following morning to do his ward round, he said, I know exactly what you've got. And it was because he'd done as his thesis on HAE way back in medical school. So having a look at symptoms, having a look at my blood results, having a look at the family history, he knew there and then that it was HAE. I used to do really stressful jobs, which I loved. I now can no longer do them. And it impacts me because I want to be out there working and I can't.
It took about 3 years, so from 15 to 18, where I got diagnosed by Dr. Anderson at Grimsby Hospital, and she just did a random blood test and said, you've got this angioedema, so a label, which was useful. And I got to uni here. It was a hard, long, arduous road, and it's still not easy. It messes with your head, and you're always thinking, am I going to have an attack, or is my tummy going to swell? Where's the nearest toilet? You scope them out. It's becoming easier, I think, but that's with age, 43, 44 this year. I'm trying to manage it. It's a lot easier than it used to be.
As a child, I had regular swollen stomachs, which they called bilious stews. And my mother also had it, but we didn't really know what it was. So, you just got over your bilious stew and that was that. And then obviously when you got into teenage years, you started swelling quite a lot. So I ended up in ITU. I had the blood tests, which showed it was hereditary angioedema.
My HAE is type 1, which means I don't produce enough of the protein or the C1 esterase to sort of stop the swellings that can happen as a consequence of the condition. So my feet will swell, my hands can swell, facial swelling and tongue swelling as well. One time I was doing some DIY and I was sawing some wood. The next day my hand was swelling up from that. So I can sometimes link it to a reason and sometimes not. So when I have an attack, I use our catabants, which is an injection, and I inject myself into my stomach. So if I have 3 reoccurring attacks from my catabants, I know that's not going to be effective, and I have to have the Berinet or C1 esterase inhibitor, and that would be an intravenous injection, which I'd go to hospital to administer. So I think it's the best situation now that I've been diagnosed and that I arrive with documentation and the medication. So documentation and medication help the process, I believe, but it's still very long because usually they're not familiar with the condition and therefore are concerned about administering the medication. Obviously, that could be anybody with any medication as far as they're concerned.
Talk to other people if you need to about this illness because it's hard. It's never going to go away. There's no cure. They're working on crazy things, gene therapy, tablets. It's amazing in my lifespan. So talk to people about it. Get some professional help if you need it because it's hard. Lean on your family. No one understands unless you've got it because it's so weird, like a lot of illnesses. So yeah, just and be kind to yourself. I push myself 100% too much. Listen to your body when you need to rest, when you need to sleep, you sleep. Join HAE groups. There are some. There was none when I was young. I think when I was 18 there was one. So if they help you, go to the groups like HAE UK. There's lots of things online. There's lots more help now for youngsters. Find someone you can confide in and maybe who's got the illness, that you can chat online, you can chat in person. Don't let it hold you back. I did uni, I've got a good job, I've got a family. Push and push and push and you will get there, but look after yourself.
I can't urge patients enough to keep a regular diary of their attacks. So if they get a swelling, they need to write down, the date of that swelling, where that swelling appeared. From the clinician's point of view, if somebody is starting to have more attacks in their stomach as opposed to it used to be peripheral, then the clinician needs to perhaps look at the treatment that patient is on, because there might be a medication that is more suitable for removing that anxiety about when the next attack is going to happen.